Okay, after covering the medication classes, one of the things I wanted to take the opportunity is to try to make this easier by looking at how do we help our patients with all of this information. So we want to teach them well because a patient can reduce their own falls risk. The first thing we want to do is look at their initial medication list. This is that medication reconciliation that we're used to. And you start with asking how long the patient's been on a medication. This is important because if they've been on a medication a long time, they may not be experiencing some of those side effects anymore. And they would be able to tell you that. So that's where you also involve them. You want to ask the patient or caregiver, does the patient, or as the patient caregiver explained, do you see that the patient has dizziness, drowsiness, or unsteadiness when they're taking medications? They may not know which medication causes it, but they may. Sometimes they can be the best person to help you assess that. And the point here is to get a baseline, because we want to know what's normal for the patient, and we can still use some of the other teaching tools to help them, but we need to know what the baseline is as other medications are added to their med profile. The next thing we want to do is look at the prescription label on the side of the bottle of any of the prescription meds they have, and really teach the patient that they can always look for that, and it's important for them to read those warning labels, whether it's from take with food, or in this case what we're looking for is things that say may cause dizziness or drowsiness. So what we want the patient is, anytime they have a medication that has that on the side of the bottle, we want them to watch for the effect, because it doesn't always occur when a patient takes the med, but it may occur. We want them to move slower, and when they move slower, that is with ambulation, so anytime they're walking around or transferring from one place to another, or when they're even rising from a sitting or lying position. And then, if possible, have someone present for observation when they have that new medication and they're watching for the effect. And if it's a non-prescription med, so an over-the-counter med, just read the bottle, because it will also list on there if there's problems with dizziness or drowsiness. The next thing we want to look at is anytime a medication changes. And this really, we focus more on the medication classes we've talked about, but it really can happen with any medication that changes, because a medication may affect the drug level of a medication. So say maybe drug A is a drug that does not cause dizziness, but it may increase the level of drug B that can cause dizziness. And so with any changes in a medication, whether it's a new medication, you have the same medication but you're increasing or decreasing the dose, those are the ones we want to watch for any changes in effect. And our guide here is going to be to teach the patient and caregiver to watch for the effect from the medication or disease state for 48 hours after they've made a change in the medication. This may also occur if you're discontinuing a med. You may, because you've already had your baseline of what you expect, so it can change when you're taking a medication, removing it from their med list. And with this, compliance makes a big difference. When I'm talking about that is mainly with your diabetic meds, blood pressure meds, and pain meds. And with those in mind, with a diabetic med, say they've been compliant on one dose, and they then either start taking more of the medication, so then it could cause more hypoglycemia, or they don't take the medication, so they have hyperglycemia, so their blood sugars rise and it can change the effect they're having. Same thing with blood pressure meds. If the blood pressure med, if they are not compliant with it, it can affect what kind of chance they have for hyper or hypo, so high or low blood pressure, which can cause that orthostatic hypotension, as far as being watchful of that. With pain meds, what we have to be careful with is sometimes a pain med does not always produce the drowsiness or dizziness. For example, with cancer pain, if there's a lot of pain, the pain medication may just take away that pain and may not cause the dizziness or drowsiness. But then let's say if the patient's getting radiation and they don't have as much pain because maybe the tumor is shrinking, then sometimes they might start seeing some drowsiness when they have not seen it with that pain med before, and they may have to then go down on their pain med to get it back at the right level. A couple other things that are not on the slides is that we want to be mindful of eye ointments and eye drops because they can cause some blurriness. With that, I recommend teaching the patient to administer when sitting down or lying down. When they're sitting down, that way, or lying down, the head movement of actually adding the eye drops can cause some dizziness for some patients. So if they're standing and they're trying to do eye drops, if they're dizzy, they could have a chance of falling. And then there is some research that a medication on the plus side, instead of increasing falls risk, it may decrease falls risk, and that's vitamin D. So you may hear that from some of your patients that they're on that to decrease their falls risk. And the last thing to talk about with this is with health literacy, we learned about asking open-ended questions. So we do want to ask our patients what they will do when they get new meds or med changes, just to see that they're understanding what we've been teaching them. Have them read the labels of their prescription medications and read the bottles of the over-the-counter medications, go slow with med changes, and then report any new drugs or planned procedures to their healthcare team. Thank you for your attention to the medication classes. And as a team working with our patients and caregivers, I feel confident we can decrease falls related to medications and thereby decrease hospital admissions and readmissions.